state health officials turn their efforts toward controlling coronavirus outbreaks in nursing homes, families with loved ones in those facilities are voicing their concerns. Western Mass News reporter Audrey Russo joins us live in Springfield with those details. Audrey?
Jordan, I want to begin with the latest numbers from the Holyoke Soldiers Home, breaking them down further. State officials do confirm to us that 21 veteran residents have died, 15 of them testing positive for COVID-19. 3 tests are pending, 2 are negative, and 1 is unknown. State officials do confirm that all the residents still at the facility have been tested, 59 of them testing positive, and the remaining 160 are negative. We're also tracking numbers from another long-term care community with a COVID-19 outbreak. JGS Lifecare in Longmeadow tells us they now have 33 positive cases, up 4 from yesterday in their facility. One family who has a relative who lived in the facility who says that they didn't feel as though they were alerted to the virus's presence quickly enough. More than 30 cases of COVID-19 have been reported at JGS Lifecare in Longmeadow. Cynthia Bastis says her father, Richard, started showing symptoms last Monday morning.
We didn't know this until later at night when they called us to let us know that he was vomiting up large amounts of blood.
Bastis tells Western Mass News over the phone that Richard was brought to the hospital where she says he was tested for COVID-19.
My father tested positive for the corona.
Fearing he caught the virus at the facility, Bastis says she called JGS Lifecare to ask if there were any positive cases inside. She says their response was limited.
It would only be if somebody happens to die from it, then they can mention it.
Western Mass News reached out to JGS Lifecare to ask what their policy is when it comes to communicating with families about possible cases of COVID-19 among residents. However, in a more general statement sent on Thursday, the president said in part, quote, "To protect resident confidentiality, we are only able to speak to designated family members and have asked them to more broadly communicate with other interested parties if appropriate."
It's terrible. We can't see him. We can't talk to him. We can't visit.
Bastis's father remains hospitalized. She says his organs are shutting down and he doesn't have much time left. Time she and her family won't be able to spend with him in person. A separation bridged by only a phone call to Richard through a nurse.
She took the phone over to him and put it in his ear so we could basically say our last goodbyes.
JGS Lifecare has sent us an updated statement where they say, in part, quote, "While we could not share details about other patients and staff, our communication team at JGS Lifecare called emergency contacts of all of our residents within 24 hours of finding out the results to inform them that we had positive cases in the building." And I asked the president, he said that communication went out on the 27th. Live in Springfield, Audrey Russo for Western Mass News.